Okay, so for obs and gynae, this is the block where you get to go away, and they already had lists up where you probably chose where you want to go. Lisa and I went to Somerset, and it was literally the best time. Swiss is best. So if you go to Somerset, just let us know how it went for you. And we shared a room. Some places you don't have to share a room. And we had, some places have like fancy stoves and things, but we had to bring pre-packed food and stuff. Anyway, so you have 2 weeks of clinic and 2 weeks of hospital. So in the 2 weeks of clinic, you go to various clinics in the area, like Bishop Lavis and those things. And then 10 days of hospital. Then you go away to like Somerset, Worcester, and all of that. And yeah, just as a general tip, you should really try and make yourself available, be ready to learn. You are going to make mistakes, but it's okay. That's the whole point of this, is so that you learn. You're gonna, in the clinics, you learn a lot about basics like testing for HIV, for syphilis, doing your lipo maneuvers, and just assessing patients as they come. Don't be scared. It's all about the learning, like I already said. And then the most important thing in this block is the maternal care book, which is this book. This book is very important. Some of you have already used it in your repro block. Basically, with this book, everything's important. As you can see, everything is highlighted in this book. You're going to have a test halfway in the block, and with that test, they're going to give you chapters where you should read through that chapter and then do the test at the end of the chapter, like cram the test. Basically know everything and anything to do with those chapters tests. And then for the end of block, it's very important that you do the case studies. Every chapter has a case study, which is very, very nice to go through. So that's very important for your tests. And yeah, just know how to do your antenatal care thing. And also learn how to do a CTG. This is what I mean. Antepartogram. Know how to do that, how to record it, understand what is multiparous, what is gravida, or what is it, primigravida, that type of thing. And also a very, very important thing in obs and gynae is to protect yourself. If you scrub in, make sure you have a visor on or gum boots, because blood and amniotic fluid will splash everywhere. And also be very prepared to smell amniotic fluid. It becomes part of your normal air breathing and all of that. So just protect yourself. If you need to buy the glasses from the TSS, it's available there. And yeah, it's very important because you don't want to be on ARVs. It's not fun.
So for family medicine, otherwise known as health and disease in the community, it is very important that you read through your study guide thoroughly and well the first time, also the second time, also the third time. Once is never enough. And familiarize yourself with this piece of paper as well. There's a lot of information in these two thingies. So that's quite important. Then just get to know which tasks are individual and which tasks are group. And for the individual tasks, it's best to do them ASAP so that you can give all your attention and time to the group tasks as the block goes on. It might seem like a holiday, and yes, it can be, but at the same time, things can become a bit stressful towards the end. So prioritize your time well and be punctual with things. Be open to the community diagnosis experience. Just live it out and enjoy it, so that when you're doing your reflections and all the other long essay kind of things, that you're being honest about yourself and you have lots of things to talk about, because it's a very project-based block, and so you might run out of words already at the end of the second assignment, and there's a lot more assignments to go. So all the best. So for internal surgery, it's very important to protect yourself. That means wear your gloves, and your N95 mask should be your best friend.
In the wards, remember to be present, offer yourself, do whatever is needed of you to do. It is a learning curve, so you are going to be scared a little bit, but you have to learn at some point.
And then when you do your history, it's important that it's very thorough. Make sure you cover your whole entire ground. And it's alright to use a template. You can put a sneaky template in your little bookie, and then keep referring to it in the beginning right to the end if necessary, so that you make sure that when you present to your doctor, you've done your very best.
Latch yourself onto a fifth year or an SI, because they know everything about hospital and they're the ones that will teach you how to do certain things, where to find things, what goes where, etc.
This is a very important point. Meal times. If you have not been scheduled time to eat, then you should not eat whenever you deem fit. I would suggest consulting with one of your doctors to find out when is an appropriate time that you can go eat, or if there is no appropriate time, remember to just keep a snack inside your pockets so that you can nibble whenever you're hungry, because sometimes an internal eating is just not on the agenda point.
Okay, so in terms of material to use, this is a nice handy book. It's about 400, 440, 450, 500 Rand at the TSS at Vanscape, or Vanscape. It's really, really nice to use, and it fits in your pockets, these large pockets. So yeah.
Another useful book is the Taylor and O'Connor. You can use this when you're studying for your OSCE because it's more specific to the systems that you need to study for the very OSCE. Look at the correlation of signs of cardio and gastrointestinal system. It has all you need to know, and you don't need to take this book to hospital.
Okay, so you're going to have extra rounds with different doctors. You need to make sure that you prepare the extra round. So you have to prepare for the extra round. You have to call up the doctor or WhatsApp them. They usually prefer WhatsApp. And then you have to WhatsApp them a day or two before you actually present the patient to them. Also, you're going to be divided into two groups in your main group. So then you have to choose between the two groups who's presenting. So just make sure you don't have arguments about that.
So for surgery, the block is broken up into trauma, burns and surgery, and you ought to have nice spots in your Google Drive. It's a good time for you to remember and learn how to do your arterial blood gases and suturing especially. Also, you're going to have lots of TUDs and they're quite important, so be attentive during this time. Then, I need to tell you a story about a girl. The story takes place in a surgical theatre and she described it very nicely. Got all dressed up, put a mask on and her gloves on. And then because she thought that she was very tight with her doctor, she went and offered help to tie his gown at the back. So as she reached for the gown, she did touch it. Boom! Unsterile, non-sterile, whatever the opposite of sterile is. It's not okay, guys. This girl had to go back and scrub in once again and then get back to the surgery. It's a lot of time wasting and it shows incompetence. So the next time you think of trying to help anybody out, don't do that. Stay sterile and you can be nice and helpful after the surgery.
So for peds, it's divided into two sections. The first bit is a theory section and then you're going to be in hospital for the second bit. The theory block or the theory section of it, you do a lot of TUDs and you do chem pathology TUDs, which you should prepare for. And then you have a hospital part or section where you go to hospital and you learn how to examine children, and then you should also organize TUDs with doctors. They're not going to organize it with you. You have to go to them and ask them for TUDs, and you have to have a TUD in every system like respiratory, cardiovascular, GIT and neuro as well. And then also you have to do a mini CVX, which is like a mini OSCE for children. So you have to examine a child, I think 2 children or just 1. You do that as soon as you can, do it as soon as possible because you don't want to run around last minute. It's a good idea to have your study guide very close because you have to get signatures for every TUD in hospital and for your mini CEXs. Also, you need to study simultaneously. If you're on the theory section of it, don't think it's a holiday. You have to study, and we all use PEDS domination. You should have it on some Google Drive somewhere. So use PEDS domination to study, and yeah, don't play.
Wow, when I can't get this thing off.